It's the Brian Lehrer Show on WNYC. Good morning again, everyone. Now we'll turn to a story that isn't getting much coverage in the media, but impacts so many Americans. Nearly one-third of adults in the U.S. know of someone who has died of a drug overdose. That's from a 2024 study published in JAMA. But recent data show that deaths from fentanyl and synthetic opioid overdoses have been declining since mid-2023. Interesting. They've gone from almost 85,000 in a year down to 48,000 in the year ending in April 2025. That's the most recent data available from the Centers for Disease Control and Prevention. That's still a lot of overdose deaths, but also a really big decline. Researchers are cautioning that it's not possible to identify a single driver of the decline. They point to several policy actions like access to treatment and overdose reversal drugs, as well as increased public awareness. They also noticed a change on the supply side with apparently a crackdown on fentanyl happening in China starting in 2023 that seems to have reduced the quantity and potency coming into the United States. And more recently, we also have the Trump administration attacks on suspected drug boats coming toward this country. They cite fentanyl as the reason for those attacks. Definitely too early to see if those are actually mattering, but we'll ask our guest about those too. It's Lev Facher, addiction reporter at Stat News, the health news site. Lev, thanks for coming on. Welcome to WNYC.
Morning, Brian. Thank you.
And listeners, help us report this story if you have a story of yourself or someone you know. Are you recovering from opioid use disorder? Maybe you have a friend or family member who is. What has been the most helpful component of their recovery or your recovery that may have saved you from the potential worst outcome, dying from an overdose? 212-433 WNYC, 212-433-9692, or maybe you work in harm reduction. You could talk about changes on the policy level in the last few years that may be working to reduce opioid overdoses, psychiatrists, addiction experts. You're welcome to weigh in too. Anyone related, 212-433 WNYC, call or text 212-433-9692. So, Lev, is this decline in opioid death rates concentrated in certain demographics, or is it kind of across the board?
It's mostly across the board. There are some exceptions to that. There have been persistently high overdose rates, particularly in Black and Native American indigenous communities. Broadly speaking, though, there has been a significant decline in drug-related mortality across the 50 states. And it's good news. There's no other way to slice it. We're essentially back down to where we were pre-COVID, with about 70,000 total deaths each year from a peak of about 110,000. So that's obviously a substantial decline, but it doesn't mean we're not still in the midst of a really terrible and generational public health crisis.
Back down to where we were pre-COVID. So most groups still had higher rates in 2024, I see, than in 2019, meaning just before the pandemic. So what's the 5-year curve there? And did the pandemic itself cause an explosion in opioid overdose deaths?
I think it's fair to say it did. It was a bit of a perfect storm. Essentially, the drug supply was already getting much more toxic prior to COVID. As people know, fentanyl took over and really became the predominant street opioid. You can't really buy heroin anymore. Even stuff that people refer to as heroin is really just fentanyl. So there was the toxic drug supply coupled with the pandemic, which disconnected people from systems of care and also disconnected people from one another. So it's no surprise that when people aren't in contact with healthcare providers and harm reduction workers and also just their friends and their neighbors and people who might be using with them to reverse an overdose and administer Narcan, if that should happen, it's no surprise that drug deaths really skyrocketed. And there was a plateau between maybe 2021 and 2023 where overall drug overdose deaths were persistently at about 110,000 in the entire country per year. And now we've kind of found the other end of that curve. So like I said, we're back hovering around 70,000 deaths per year. We might be plateauing a little bit, but of course there's hope that the trend will continue and deaths will go down even more.
As I said in the intro, there isn't one single cause of why the numbers are coming down, but let's go through a few of them, beginning with public policy changes like access to overdose treatment and harm reduction efforts. What's been most important there, if you can tell?
I have to admit, Brian, I'm a little skeptical that public policy changes explain the magnitude of the shift. It's certainly a good thing that there's more access to medications for opioid use disorder, like methadone, like buprenorphine. It is certainly a good thing that there is more access to naloxone or Narcan, the overdose reversal medication. I don't personally think that those changes alone really explain a reduction in overall drug mortality from 110,000 to 70,000. I think there are other big theories that you mentioned, like the drug supply shift, that are bigger factors. So the public policy changes are celebrated, and I don't want to diminish their importance, but I think we're also talking about kind of bigger cyclical factors
Hmm.
here that would be occurring probably anyway without those public policy changes.
So the drug supply factor, is that a China story?
In part, it is a China story, and there was an interesting research paper you alluded to a few moments ago from some American drug policy scholars back in January that essentially theorized that the Chinese government has started cracking down on precursor chemicals, on just the chemical components that are often exported to Mexico and elsewhere that drug cartels in turn synthesize into fentanyl. And as a result, fentanyl potency in the United States is dramatically down. And that is documented. That is known. So in part, it probably is a China story. If they're doing a better job preventing the export of precursor chemicals to people who would turn those chemicals into fentanyl and smuggle that fentanyl into the United States for sale, yeah, that's certainly gonna reduce fentanyl potency and hopefully overdoses along with it.
Are you saying in part that people using opioids may find that there's less potent fentanyl or just less fentanyl mixed in to whatever they're taking because of economic pressures in China?
You know, it's hard to paint with a broad brush here because drug markets at an individual level really vary. So what you're buying in one city to the next is not necessarily the same.
Mm.
I think at 30,000 feet, though, yeah, there is less fentanyl. Fentanyl concentrations in the illegal drug supply are lower. That's not to say the drug supply isn't still incredibly toxic, and there are adulterants like xylazine or tranq, which is this veterinary sedative that can lead to these really horrific skin wounds, and that's very present in Philadelphia and really around the country at this point. But yeah, fentanyl concentrations specifically have decreased, and that is thought to be at least a contributing factor in the reduced overdose deaths.
Let's take a phone call. Kathy in Brooklyn, you're on WNYC. Thank you for calling in, Kathy. Hi.
Hi, thanks for taking my call. This is such an important issue. I am a recovering heroin addict. I used mainly in the 90s and 2000s with some relapses, and I am so fortunate that fentanyl was not in the supply as much then because I mainly used street drugs. I've lost many friends to overdoses. I've overdosed. There was no Narcan. Did lots of rehab, lots of therapy. Nothing worked except Suboxone, which is medication-assisted therapy. And so many treatment programs and even doctors reject it out of hand, saying that, oh, you're still using, it's still an opiate. Well, it is, but you don't get high from it. What it does is it blocks the receptors that you can't use. And whenever I've gone off it, despite all my intentions and hard work and therapy, I've always relapsed. And this is saving my life, and I can't go off it. And I wish that more doctors were open to it because it is a lifesaver.
Thank you for saying it out loud on the air. Kathy, are you familiar with Suboxone, Lev?
Absolutely, yeah. Kathy raises a really important point here. And there's kind of a bad side to it and then a good news aspect. So the bad side is she's absolutely right. There's two drugs that act as opioid agonists or partial agonists, so that the analogy I would give is a nicotine patch, essentially. And to Kathy's point, there's a lot of opposition out there to people who use these opioid-based medications to stave off withdrawal and opioid cravings, and that just allow them to lead normal, healthy, productive lives. Because there's this view that, oh, if you're using a molecule that's an opioid, that's no better than using heroin or fentanyl. But it just doesn't hold up, because if you go back to the nicotine patch analogy, there's no one out there who gets mad at someone who's trying to quit cigarettes for still, using
Right.
nicotine. There's no one who says, oh, you're using nicotine gum. What's the point of even quitting cigarettes? So obviously, there are massive, massive health benefits to these medications. They are shown to reduce opioid overdose mortality dramatically by more than 50%. And, think about how few drugs that's true of. A drug for a specific disease that reduces your chances of dying by more than half, that's astounding. So the good news is that I think the phenomenon Kathy is describing, with hostility from medical professionals and just society in general, it's very much present, but I think it's also fair to say it's a lot less true than it was a decade and 2 decades ago. So things have gotten better in that regard, and there's no doubt that methadone and buprenorphine, or Suboxone is the common brand name, are critical elements of this country's overdose response.
Also joining us briefly is Michael McCrae, Chief Program and Strategy Officer at a group called Start Care. Start Care is a New York City nonprofit which offers opioid treatment programs as well as an outpatient program. Michael, thank you for joining us. Hello.
Hello, how are you? Thank you. Yeah, so I really appreciate Mr. Facher's kind of mention of racial disparities. I mean, I'm thinking a lot in this conversation. And like you mentioned, Start Care, we're actually the nation's largest and oldest Black-founded healthcare and research organization of our kind. So we have, we do addiction, mental health, social care, and research across 7 locations across Manhattan, Brooklyn, and the Bronx. Mm-hmm. And so I appreciate kind of the conversation around kind of the racial disparities in overdose deaths. So, here in New York City, we saw like almost a 30% decrease from 2023 to 2024 in overdose deaths. And that was really the first time that the deaths had decreased since, 2018 among Black and Latino New Yorkers. So we still, we saw like Black and Latinos had like really the largest kind of decreases, but still, 1.5 to 2 times the rates of white folks of the same age. Mm-hmm. And I think you think about, neighborhoods as well. You think about, that kind of the most recent data from the city pointed to that there was, the least decrease in the Bronx and the most in Staten Island. But if you look at kind of patterns of how people are dying from overdoses, opioid overdoses, you see a very similar pattern with like poverty, mental health challenges, substance use challenges more broadly, chronic disease, most 911 calls for mental health challenges. I mean, you see a very similar pattern across the city. You see kind of the Bronx, with some of the largest challenges, then followed by like Upper Manhattan, some places in East and Central Brooklyn. But you see that pattern consistently, not just in overdose deaths, but across the spectrum in terms of mental health, substance use, physical health, and social challenges. So to me, it's very systemic. And so I appreciate the conversation around harm reduction. We know it definitely works. Between naloxone, fentanyl test strips, xylazine test strips, education, and obviously treatments, the kind of the medications for addiction treatment that were mentioned earlier, Suboxone, methadone, we know we're saving lives. But it remains a challenge that kind of this racial disparity continues to persist.
Are you saying if we really want to fight opioid deaths and opioid death disparities, or any kind of drug overdose deaths disparities, we need to fight poverty? We need to fight economic inequality?
Absolutely, yeah. I mean, and at Start Care, actually, we think about the social determinants of health as being just as important as kind of the clinical care, right? So we think about housing, we think about access to economic opportunity, we think about access to kind of good quality care that meets people where they are and giving them what they need, and then we think about food as well. So these are things that people that we're seeing on the ground are saying that they need: housing, food, economic opportunity, and access to kind of broad care.
Do you see any new kind of responsiveness, since you're a New York City organization, on the part of the Mamdani administration than anything that came before?
Well, I think that, it seems that the mayor continues to kind of, support the work, our addiction, mental health, and so forth. Here in the city, we have the first two kind of overdose prevention centers, places where you can have, you can consume in a supervised way. But I believe the mayor continues to be supportive of that. But also more broadly, I think we're seeing that, this administration does want to make sure that there's, help for people with addiction and mental health challenges.
Michael McRae, Chief Programs and Strategy Officer at Start Care, a New York City-based nonprofit which offers opioid treatment programs as well as outpatient programs. Thank you very much for joining us.
Thank you.
And we go next to Melinda in Cleveland. You're on WNYC. Hi, Melinda.
Hi. Thank you for taking my call. I was just listening to WNYC, yes, even though I live in Cleveland, but I always listen to your show whenever I can. I'm a teacher. I'm on spring break, but I am also the founder of a small youth prevention nonprofit, which I started after the loss of my son when he was only 19 in 2021 from fentanyl. And thank you. Yes, it truly never gets easier. And I have a lot of comments that is a piggyback off of what the gentleman was just saying now. I do believe it can be based on social determinants, but also I have made so many friends that are in the same situation I am, and believe me, they are from all different socioeconomic status, all parts of the country. The landscape of the drug use has really changed. It's really more like, I like to say it's more like a minefield. Like when it comes to fentanyl, that a young person cannot just be experimenting. It doesn't take years and years to become addicted or to overdose and die. It can just happen the first time you try. And if you don't lose your life, you certainly lose your life to addiction with fentanyl. And I do see a decrease. Our area, our part of the country is very, very hard hit. The year that we lost our son, we lost 5,000 lives in Ohio that year. And I do think that Narcan, I do think education and helping young people recognize their mental health needs and being able to ask for help are really the most important factors in this fight. So, yeah. And if not fentanyl, as someone mentioned on your show, there are so many other very lethal and life-altering substances out there now, too. Right. So it's important to look at the mental health.
Well, again, I'm so sorry for your loss, but very much appreciate it that you called the show to speak up for what you think is needed to help prevent more deaths in the future. Melinda, thank you very much for calling from Cleveland today. And Lev, and my guest for another few minutes is Lev Facher from the health news site Stat News, as we talk about the decline in opioid deaths in the United States, although it's only a decline to pre-pandemic levels. When she mentions other toxic things, one person told me, well, yeah, for these various factors that we've been discussing, for those reasons, fentanyl related deaths are going down, but cocaine related deaths are not. Is that something you know to be true?
Absolutely. Not just cocaine, but also methamphetamine. There has been a notable increase in the use of stimulants and deaths resulting, at least in part, from those stimulants. So, people talk about this as kind of the fourth wave of the crisis being what are called polysubstance deaths, people who use both fentanyl and meth, fentanyl and cocaine, some combination. There's just a lot of toxicity out in the drug supply, and certainly fentanyl is not the only thing out there that can kill you or harm you.
Listener writes, I am no fan of Trump, but didn't he make the connection between illegal immigration and fentanyl supply, and now we're saying that there is lower fentanyl amounts in the U.S. and lower deaths? Was he right? Asks the listener.
I guess I would note a couple things. One, that the reduction in overdose deaths began squarely during the Biden administration. And another, there's certainly good reasons to be careful about, what comes in through any border, particularly the southern border, and preventing fentanyl trafficking. There's not really many people out there who are going to argue against it, but I don't think the bulk of fentanyl being trafficked into the United States is, in the backpacks of individual migrants who are crossing the border looking for, jobs or better lives for their families. We're talking about the actions of big drug cartels and, really systematic, these are billion-dollar operations. So, yes, southern border security. There are people kind of even, in the center or to the left on drug policy who would rather we focus on treatment, but they're not going to argue against having
Hmm.
good drug interdiction at the border. But I would hesitate between drawing any line between actual illegal immigration and
Hmm.
drug deaths, both at a practical level and at a statistical level. Just this decline started far before Trump took power for his second term.
And beyond immigration, what about these Trump boat attacks? They claim it's to stop fentanyl smuggling. Can he be right?
Not really, because fentanyl is not really coming from the places that these boats are originating from. These are boats in the Caribbean. Some are coming from Venezuela. It's possible, it's even likely that many are trafficking cocaine in particular. And look, cocaine is a deadly substance, and I suppose it's good to prevent cocaine from being trafficked into the United States. But when you talk about what's actually driving the majority of deaths, we're still talking about fentanyl, and fentanyl is coming mostly from Mexico via these precursor chemicals that are shipped from China. So no, it's not really apples to apples. These might be drug smuggling boats. They might have drugs on board. The drugs on board are probably not fentanyl.
And just to finish up, one more Trump administration thing. I mean, this whole conversation is premised on knowing the number of deaths from drug overdoses. You note in your article that the DEA, the Federal Drug Enforcement Administration, no longer publishes regular data about drug purity and price. So we know that the Trump administration is halting the publication of so much health data. Is this an example of that, and for a ideological or political reason?
I would actually point to even a different change the Trump administration made, which is they had really immense layoffs at the Substance Abuse and Mental Health Services Administration, which is an agency that oversees most drug policy and substance use treatment efforts throughout the entire country. That agency has been totally decimated by the Trump administration. They have, I think, fewer than half of the total staffing they had as of the day Trump took office. And one of the units that specifically was eliminated was the team that worked on the national survey on drug use and health. So there was an entire dedicated data team that put out a really comprehensive annual report, and it's still being worked on in some fashion by outside consultants, I believe. But there's no question that the Trump administration has gotten rid of a lot of really key experts in this policy space, people who are not really partisan, who are not left wing, right wing. They're just career civil servants who've been doing these important but very under the radar, policy data jobs for a very long time. And it's worth noting, Brian, a couple other Trump administration efforts. One, they have announced something called the Great American Recovery Initiative, which is supposed to be this sweeping plan to once and for all tackle the epidemic of drug use and overdose death in this country. They've said a lot of the right things. There are a lot of people who are talking about drug addiction and drug use as a disease rather than a moral failing. They're talking about kind of the comprehensive wellness landscape that a couple callers have mentioned that contributes to people's use and people's safety. The bigger question, though, is what resources and what funding will be behind it. And so far, they've actually gone in the opposite direction. They actually briefly canceled about $2 billion in grants to substance use and mental health organizations that are really the backbone of the country's opioid crisis response, and they uncanceled the grants after backlash. So most of that money still got out the door. But the Trump administration, they're talking a big talk, and whether the actions end up matching that rhetoric, that is very much an open question, and so far it hasn't.
Lev Facher, addiction reporter at Stat News. Thank you so much for giving us all this information and context today.
Thanks, Brian. My pleasure.
Since WNYC's first broadcast in 1924, we've been dedicated to creating the kind of content we know the world needs. Since then, New York Public Radio's rigorous journalism has gone on to win a Peabody Award and a DuPont Columbia Award, among others. In addition to this award-winning reporting, your sponsorship also supports inspiring storytelling and extraordinary music that is free and accessible to all. To get in touch and find out more, visit sponsorship.wnyc.org.